All rise for the Honorable Judge Jenny. Please be seated. The court's first case is Schaefer versus Tobel in the case of thalassemia, anemia.
Your Honor, my client, Aya Jafar, came to see Mrs. Tobel, a physician assistant for anemia, and was treated with iron. Today, I will prove that Mrs. Tobel negligently treated Ms. Jafar with iron instead of looking carefully at her lab work and seeing that she clearly has thalassemia. We are requesting $1 million for punitive damages.
Judge, I'm going to prove that I acted in Ms. Jaffer's best interest, and I cannot be held responsible for any labs that I may have ordered. That would just be unreasonable.
Plaintiff, you may call your first witness.
Your Honor, my first witness is Aya Jafar.
Jafar, will you stand and raise your right hand, please? Left hand on the Sickles. Tell the whole truth, nothing but the truth, so help the Sickles? I do. Your witness.
Thank you. Mr. Jafar, can you describe your symptoms the day that you saw Mrs. Tobel in her clinic?
So I've been feeling a little bit extra tired lately, and I used to be able to run a lot more, and it seems like I can't do so anymore without getting really short of breath, so I figured I should be seen by somebody.
And what was your diagnosis?
She told me I had anemia.
Okay, and how were you treated?
She seemed kind of busy that day. I got some blood work drawn, and she basically just told me to take some over-the-counter iron supplements twice a day.
And you did take the iron?
I did. I ended up at the emergency department with really bad abdominal pain and vomiting. Luckily, I was able to see a really good PA named Michael Wera, and I was treated for acute iron toxicity, and I was told that I had thalassemia.
Sounds horrible. It's horrible, and I'm really glad you recovered. No further questions, Your Honor.
You may call your next witness.
Your Honor, I call Ms. Kylie Tobel.
Ms. Tobel, you swear to tell the whole truth, nothing but the truth, so help you Sickles?
Thank you.
Your Honor, if the bailiff would please put up evidence number 3 on the screen. We have a copy of Ms. Jafar's lab report the day of her visit. Ms. Tobel, can you please read the labs for the jury?
Well, our hemoglobin's 10.2, our MCV was low, so it's like microcytic anemia we learned. I figured she had to have iron deficiency anemia. I mean, she's of childbearing age, and being, how it was, I thought iron would be the best treatment.
Did you even consider in your differential diagnosis beta thalassemia minor?
Well, I thought that was just something that infants got, and it was diagnosed really early, so there was no way she could have that. So
I see. Ms. Tobel, you're actually thinking of beta thalassemia major, which we know is a homogeneous genotype. But in this case of Ms. Jafar, she actually had that beta thalassemia minor, which can present as iron deficiency anemia, but however is completely different. Bailiff, can you please put up the next piece of evidence? Hemoglobin is made up of a heme group, globin, and iron. And in beta thalassemia minor, although the pathogenesis is unclear, we know that it's a single gene mutation which causes both reduced beta globin production. This results in less hemoglobin and therefore less red blood cells and a less iron carrying capacity. So we know that even though she has a less iron carrying capacity, she does not have a reduction in iron. And had you looked at her ferritin levels, Ms. Tobel, you would have seen that she had normal ferritin. And you did not even order her RDW or her transferrin saturation, which would have made the diagnosis very clear. Also, Ms. Tobel, if you remember that beta thalassemia minor is very common in Mediterranean descent, And Ms. Jafar, what is your ethnicity?
I'm Lebanese, which is Mediterranean.
I rest my case.
The witness is excused. I've heard enough. Due to the negligence on Ms. Tobel's part in overlooking the iron studies and mistreating Ms. Jafar, I order that Ms. Tobel pay Ms. Jafar the full asking amount of $100 million. Case dismissed. Next case is Wolbers versus Tobel in the case of sickle cell anemia.
Your Honor, I present the case of Mrs. Wolbers versus Kylie Tobel in the case of misdiagnosed sickle cell anemia. Ms. Wolbers went to see Ms. Tobel presenting with acute pain and signs of sepsis. Ms. Tobel refused to treat Ms. Wolbers, and because of that, Mrs. Wolbers' symptoms progressed. We are requesting $1 million trillion in damages.
Very well. You may call your first witness.
Your Honor, my first witness is Ms. Wolbers.
Ms. Wolbers, do you swear to tell the whole truth, nothing but the truth, so help you cease?
Yes.
Your witness.
Ms. Wolbers, how did you present Ms. Tobel the day you went to see her in her clinic?
Just first, after watching the last case, I just want to make it clear that I'm African American.
Thank you.
Anyway, I was having a lot of pain in my extremities, especially my hand, for the last 5 to 7 days. It usually happens at a time. It actually felt like my spleen was dying, and I was getting infections. This usually happens when the weather changes and I get really stressed out.
And how did Ms. Tobel treat you that day?
She told me I was drug-seeking. She sent me away, even though I had sepsis and I was dying. I had acute chest syndrome, and I couldn't even really breathe. It was a good thing there was a nice PA there named Michael Guerra at the next ED I went to, or else I would have died. You realize I had undiagnosed sickle cell anemia.
I'm glad to see that you have recovered from your illness. No further questions, Your Honor.
You may call your next witness.
Your Honor, my next witness is Ms. Kylie Tobel.
You swear to tell the whole truth, nothing but the truth, so help you cease.
So help me.
Yes, continue.
Mrs. Tobel, on the day that Mrs. Wolbers came to see you, why did you turn her away when she was in such acute distress?
Well, see a bunch of shady characters all the time coming to me for drugs. I couldn't risk it, you know? I've been hit up for narcos so many times, but just people, I didn't want to lose my license. You know, I didn't want to examine her. She was really distressed. And I'm really sorry now.
Sorry doesn't cut it, Mrs. Tobel. Had you looked closely or had talked to Mrs. Wolbers, you would have seen that she is a high risk for sickle cell anemia based on her symptoms, her ethnicity, and her family history. Bailiff, can you please put up the next piece of evidence? Sickle cell disease is an autosomal recessive genetic disorder. This occurs when the mutation occurs in the hemoglobin beta chain, forming hemoglobin S. When the red blood cells containing this homogeneous hemoglobin S are exposed to a deoxygenated condition, which is low oxygen saturation, they undergo the sickling process. This eventually causes the red blood cell to take on that sickle shape, which it impairs its flexibility and it becomes more rigid. This causes it to get stuck in the arterioles, which then contributes to vaso-occlusion and ischemia, which caused the pain that Mrs. Wolbers was experiencing.
Ms. Tobel, you are lucky that Mr. Guerra was able to see her and properly diagnose this disease. Your license to practice is being revoked until you are able to study and retake your hematology exam. Until that time, you are ordered by the court to pay Ms. Wolbers the $100 million dollars. Bailiff, please take it. Signature.
I'm sorry, my fault. Sorry, Karen. Let me down.